It's all about Maryland living.
Welcome to Maryland Spotlight. I'm Kim Knight. Well, as men age, they can suffer an enlarged prostate. Joining me, Dr. Sankar Kausik, Director of BPH Program at Chesapeake Urology. Thanks for being here today, Doctor.
Thank you very much for having me.
Yeah. Now, what is BPH or enlarged prostate?
So the prostate is a walnut-shaped organ at the base of the bladder, and as men get older, oftentimes starting in their 40s, the prostate starts to increase in size. And as it does that, it compresses the channel that you urinate through, producing symptoms of BPH. And those can be a weak stream, feeling a sense to have to go more frequently to the bathroom, waking up at night to go to the bathroom, and a sudden urge that you have to get to the bathroom right away, all of which can be a significant nuisance to a patient's quality of life.
Absolutely. Now, talk about some of the treatment options.
So traditionally, when men presented with these symptoms, they were either given medications, which unfortunately have some side effects, which they'd have to continue for the rest of their life, or the older procedures, which involved using heat or scraping the prostate, which were oftentimes resulted in side effects, including sexual side effects. So those were what men had as options before, but UroLift is a new revolutionary therapy which has really changed the treatment of BPH for men.
Talk about UroLift.
So UroLift, as I was mentioning, was FDA approved in 2013. It's a revolutionary therapy where little implants or clips are placed in the prostate to open the prostate up. This does not involve any cutting, scraping of the prostate or heat therapy, and these implants essentially create a wider channel for urination, and men recover very, very quickly from the treatment and has minimal to no side effects.
That's what I was going to ask you. How is the recovery, and when can patients see a difference in their symptoms?
So the treatment takes under an hour and oftentimes just done in the office, and men can see an improvement in their symptoms in as little as a week.
Wow.
In terms of recovery, usually within a day or two, they can get back to their normal activity. One of the really interesting things with this treatment is most men will not need a catheter after the procedure, unlike the more traditional treatments for BPH. So this has really been a game changer for men in terms of treatment and recovery.
Now, is it covered by Medicare?
It is. So it did get FDA approved, as I mentioned earlier, in 2013, and it has since been covered by Medicare, and it is a revolutionary therapy, I think, that will make a great impact in men's lives.
Well, prostate health is certainly very, very big issue, especially for men. So we want to direct our viewers, our men, or their wives or significant others to the website ChesapeakeUrology.com.
Yes.
Great. Thanks for joining us today.
Thank you very much.
And thank you for tuning in to Maryland Spotlight. I'm Kim Knight.